You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering any type of cosmetic dentistry. It's an extreme makeover edition. And with us, we have an expert on the topic. He's known for creating natural-looking smiles, Dr. White. Dr. White, welcome to the program.
Nice to be here.
Pleasure to finally meet you. And you brought a lot of photos, and they look good.
Thank you.
Now, before we get into today's topic, tell us a little bit about your practice, because I guess you do more than just cosmetic dentistry.
Well, our practice is a very full practice. We see people from all walks of life. We see everything from TV personalities to professional sports people to business people, attorneys, doctors, and everyday people who come to us because they just are dissatisfied with something about their smile.
You see a lot of people go, many years without smiling. Well, is that right? Well, people that insecure about their smile?
Well, some people very much so. They've neglected their smile. They've not had good dental care. Maybe their circumstances were such that they didn't have dental insurance or couldn't afford good dental care, and their life circumstances change, and they want to be good to themselves. They want to present themselves positively to the outside world.
Okay.
And so, when it's time, they come and see me.
All right. Now, at the top of the show, we said you were an expert on the topic, but you really are. I mean, clinical instructor. You used to teach dentistry where?
Both at the University of Pennsylvania Dental School and also at Temple University Dental School.
Okay, and you're also, you teach other dentists, cosmetic dentistry?
I do.
You lecture?
From time to time, I get invited to lecture, and it's a pleasure to do that because I draw upon a world of experience, not only since the time I graduated from dental school, but my dad was a dentist. So
Your dad was a dentist?
So I've been around dentistry all my life.
Did you always want to be a dentist? I mean, when did you know I want to be a dentist?
Well, when I was in 11th grade, I had the decision to make whether to go to medical school or whether to go to dental school. And I toyed with that decision for a long, long time. It was almost like flipping a coin sometimes. I think about it that way. And then I thought about it and I said, I'd rather not be dealing with life and death issues, which I found difficult to deal with. I think I'm going to go to dental school. And it was one of the best decisions I ever made.
You like being a dentist?
I do. I love it.
You do. What's the best part, especially in the world of cosmetic? I mean, you see huge transformations in personality, self-esteem, things like that?
Well, when I graduated from dental school and learning my skills and so on, I graduated at a time where dentistry was involved in fixing teeth and taking care of toothaches and all the other things that dentists do and that I continue to do to this day. I never could believe that as a cosmetic dentist, dealing with people's self-esteem, dealing with people's appearance would be so rewarding.
Interesting. So let's begin with the different categories then of cosmetic dentistry that you see.
Well, the types of things that we do have to do with things like whitening, which brightens someone's smile and makes it look more youthful.
Okay.
We do porcelain veneers, which are able to change the color completely. It's also able to change the size and the shape and the positioning of the teeth in the smile. And it has been a wonderful technique and wonderful technology to use in helping someone improve their smile.
Okay.
There are caps that we use, and the modern caps eliminate the black lines that many of the older style caps use.
I see the black line at the top.
Yeah.
What is that? What is that?
Well, it's two things really. Sometimes the cap was placed on a person's tooth and the person's tooth was naturally dark.
Okay.
And then over time, if the gum has receded a little bit, that black of the tooth root shows. The other thing is that when we used to use more predominantly metal in the capping process, sometimes the metal line itself used to show. We've eliminated that by some advanced technologies and some advanced techniques, and the smiles look gorgeous. So when you see that, by the way, I mean, you see that the very top of one of the front teeth, that's an easy fix. Well, you redo the crown, typically.
Now, you say you're changing people's lives, that you change their smile, oftentimes you can change their life. How so?
You do change their lives because you give them confidence. You give them something to be proud of.
Now, with veneers, though, respectfully, I feel like when I see veneers, I could spot them 20 yards away. They're big, they're bulky, too bright, too white.
Well,
is that in the hands of the dentist? Or
in order to have a successful cosmetic case, it takes a team of people. The dentist is the quarterback of that team, but it also takes very skilled artists, very skilled technicians to actually produce the veneers and to produce the crowns. And when the team works beautifully together, you get a beautiful result. When the team does not work beautifully together, you can spot them across the room.
Okay, okay. So these photos here, let's take a look. What are we looking at here?
Well, this is Christine.
All right.
Christine had crooked teeth. She had dark spaces in her cheeks where the cheek is, so that it looked like the only teeth that she had was front teeth, that you couldn't even see her back teeth.
Pretty nice smile, though, for the most part.
It was a nice smile, and she was the one who came to me and said, can you do something about this? Because she was the one that didn't like it.
Okay, okay. So on the right side of her mouth, a little bit of a hole, kind of, I guess the two front teeth, not very straight. What do you see? I mean, when this consult comes to you, what do you see? What does your eye look at?
My eye sees the crookedness. It sees the slantiness of the teeth. It sees teeth, some are prominent, some are retruded. I see teeth that are all different colors. And I see somebody who has such a wonderful potential to have a beautiful smile.
Do you see the end result? You know, they say with artists. And by the way, do you consider yourself an artist?
I do.
There's art to this?
I do.
Do you see the end result when you do a consult?
I see the possibility of an end result, and then part of the work that I do is to make sure that somebody gets that.
All right, all right. Okay, so with her, what did you do?
Well, we did a combination of some capping and some porcelain laminate veneers to change the shape, to change the size, to change the color, and to change the positioning of the teeth so that in the after picture, as you'll see, it looks gorgeous.
Okay, let's take a look.
Now, I want you to notice that Christine made a mistake.
And what is that?
Well, the mistake was, if you look very, very carefully on the right-hand side of her mouth, you'll see that there's one crown that doesn't quite fit.
Yeah.
And she asked me not to do that tooth for her when we planned her.
That's on our viewing left side.
Well,
okay.
it's the right side of her mouth, our viewing left. And she asked me not to do that in the original plan. When she saw the final pictures, when she saw the final smile that she had, and that one particular crown stood out like a headlight, she said, Dr. White, could you please redo that crown for me? And of course we did.
And you did.
So when you say that a smile that has veneers looks in some way artificial or bulky or just doesn't look right.
No, not this. I'll agree with that. Okay.
You have to understand the design that goes into this smile. This smile is made in such a way so that the edges of the teeth follow the lip line. The colors of the teeth are not all the same. They're subtly varied, just like nature does it. And it duplicates what would have happened had Mother Nature been really, really great for Christine and had given her that smile to begin with.
She looks younger, by the way. When I'm looking at these two, she looks younger. She looks more sophisticated, you know.
Well, the smile is the centerpiece of your face.
Well, you're a dentist. Of course you think the smile is important, right?
Well, it is. I mean, you do express expression with your eyes, but the other thing that you express your emotions with, that you express your moods with, is your smile. And again, when you meet somebody, if they have a great, warm, inviting smile, that's a person that you want to get to know. So the proof of the pudding in what makes a smile a successful makeover is that before, Christine didn't smile very much. She was shy. She was not as outgoing as she would have liked to have been. And with this new smile, you can see the whole face changes.
Yeah. Did they tell you they get compliments?
They get compliments all the time.
Do they flash their smile, their new smile?
The interesting thing about the compliments, Randy, is that people, if the smile is well done, people will say things like, well, did you do your hair differently? Are you using different makeup? Gee, you look
So they don't
great.
quite know.
But they
Interesting.
don't quite know or understand that the major change was the teeth. And that is a beautiful success, because you really don't want it to stick out like a sore thumb that, you know, that you've had your teeth improved.
Okay.
And you want it to look natural, and you want it to look like it grew there.
Knowing you were coming today, asked around, and some of the fears about veneers, and not knowing what they're going to look like, how much say-so does the patient have, and how much of a glimpse do they get in what their teeth are going to look like in the final outcome?
They will either bring in pictures, we will look at catalogs of smiles, they will have several opportunities to pick the color that they like. And once that's done, then what we do is I send molds of their mouth to my artists, and they return to me a sculpture of how they interpreted the requests and the preferences of the patient.
Okay, okay.
And when they return that, the patient is able to see
Their teeth.
what they will look like, and they get to see that before I ever even touch them.
All right.
So it's a wonderful way for them to preview their smile and know that they're going to get the smile that they wanted.
Now, when they finally get their teeth, I guess there's a temporary process, but when they see themselves in the mirror, is it an emotional time?
It is an extraordinarily emotional time.
Really?
We keep a whole box of tissues right in the room because we know we're going to need them.
Okay.
And the tears come, whether it's a man or a woman. The change is just,
Really?
it's a life-changing event, because something that has been bothering them for years and years and years has now been enhanced, improved, and it's been improved exactly the way they wanted it to be.
And they last pretty long. I mean, they could be as strong as regular teeth. I mean, they shouldn't fall off if you do it right.
Well, I can tell you, my wife has veneers for over 20 years.
Okay.
And it's about 20 years ago that the porcelain veneer technology first came to dentistry. So I can tell you that they're still going strong.